Hello, everyone. Glad to see you all here today. I think summer is coming. I don't know when, but I guess it'll be here soon. We miss spring. But anyway, before we really start the meeting, I'd like to welcome a new member to our team, Kathleen Macy. And Kathleen has been very, very active in many places in Yorktown, and now she's joined our team, which we're all very happy to have her. So if we'll all please stand, and Kathleen will join, the start of the pledge and a moment of silence, please.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
And I'd like us to take a moment of silence. We have people to remember, of course, our first responders, our military, the men and women of the law enforcement who are keeping us safe, and anyone else that you'd like to give a prayer for.
Thank you. I'd like to introduce our board for the day today.
Francis T. McVetti.
Daryl Lindholm, Rosemary Panio,
Jenny Minton.
Deborah Marks, Liaison to Assemblyman Slater's office.
Kathleen Macy.
Thank you.
Noreen O'Driscoll.
Joe Falcone, Parks and Rec.
Diana Quast, Town Clerk.
Thank you. Ed Lackerman, please. Would you like to come up for a moment?
Supervisor.
I think everyone knows Ed's our supervisor, in case you don't know.
There are a couple of faces I might not know, like that lady in the background over there.
You're going to get in trouble. I would stop now.
I live in trouble. Since we had that moment of silence, I will bring. We did lose 3 people this week that were associated with the town. First, the mother-in-law of Judge Gary Raniolo, and she's also the grandmother of one of our police officers, had passed away. Phyllis Adams. And we also, unfortunately, lost one of our Yorktown Lions, Sharif Hachette, who was big with the Halloween parade. And the next day, unfortunately, lost Stu Glass, who worked for the town. His services were today. Stu did a lot of great things in the town on the outside of Town Hall, but was also very instrumental working with Alon Gilbert when Alon was a supervisor. So please keep their families in your thoughts and prayers. So to brighten things up after that, I am going to yield the rest of my time to Gary Link, our town assessor, as we do have some deadlines coming up for exemptions. Gary, would you like to take the podium? And I will take this moment to wish everyone a happy Passover, good Easter, everything that you celebrate. Please do it with your family, do it, enjoy, and hold on and cherish those moments.
Good.
Thank you, Ed.
Thank you.
Good afternoon, everybody. As was just said by Supervisor Lochterman, we have an exemption period coming up very shortly. All exemptions in our office need to be in by May 1st. That includes all senior exemptions and veteran exemptions and fire exemptions, etc. I'm going to leave a couple of handouts in the back here for anybody who's interested in picking them up. We have our senior exemption. We mailed out a reminder notice to everybody in January. We are also sending out a reminder notice this Monday to everybody who has not applied yet. So if you have not applied with our office yet, please come and visit us. We sent out all the information that's needed for you to bring back to our office. So we do have 2 senior exemptions for those who might not be familiar with them. We have the Star Enhanced, which is based upon adjusted gross income, and that adjusted gross income needs to be under $107,000, and that would be based upon your 2023 return. The other one would be the other senior exemption we have is more of the lower income senior exemption, and that is also based upon income, and the income would need to be under $58,000, and that's total income, not adjusted gross. Now, I'm going to say that if anybody has any questions whatsoever, you're always welcome to stop by or call my office. My number here is 914-962-5722, and our extension here is 227. So if you have any questions about anything, having trouble getting anything to us or what have you, or know of somebody that might be able to qualify for the exemption, please give us a ring. We'd be more than happy to help as much as possible. So again, May 1st this year is our exemption deadline, so that all needs to be in our office. So does anybody have any other questions for me? Yes, sir. Yeah, absolutely. 914-962-5722, and our extension here is 227. Okay.
Thank
Very
you.
good.
You're
Thank
welcome.
you very much.
Questions?
Everybody have a great rest of the day.
Thank you. Thank you.
We have Wendy out there. Wendy, do you want to introduce our next speaker, please?
Jenny,
Thank you.
Q&A starts. Just tell them we'll repeat the questions. Oh,
Hey, everybody. How are you?
Good.
Hi, Wendy. Hi.
Nice to see everyone.
Excuse me, Wendy, just one moment. Would you be able to tell your speaker when they ask questions to repeat the questions so that the people watching TV can hear them, okay?
Christina actually can tell you that when she first sat down next to me, I said, remember when you talk into the mic.
Thank you.
But thank you.
We always forget to do that,
It's
and then they
usually
don't
good.
hear the question.
And it's usually good to say something 3 times for someone to remember anyway. So there you go. Please, when they ask the question, please speak into the mic, Christina. Hi, I'm Wendy McNamara, Community Affairs Coordinator, New York Presbyterian Hudson Valley Hospital. I'd like to thank Jenny, Rosemary, and everybody on the board for inviting us to speak today. New York Presbyterian Hudson Valley Hospital is your neighborhood hospital serving the heart of the Hudson Valley community with specialties in cardiology, cancer care, digestive health, radiology, orthopedics, physical and occupational therapy, obstetrics, and gynecology. It is now my pleasure to introduce my colleague, Christina Shen. Christina is a cardiovascular service line liaison at New York Presbyterian, who will be speaking on the important topic of stress and heart health. April is Stress Awareness Month. Christina graduated from Case Western Reserve University with dual degrees in nursing and political science. She also earned a Master of Public Policy from the University of Chicago with an intention to change health policy and advocate for patient access, and is currently pursuing her MBA at Johns Hopkins University.
Wow.
Very good.
Christina previously worked as a heart failure and pre-heart transplant nurse at Northwestern University of Chicago and Columbia. Welcome, Christina.
Basically, I just have a very, very expensive addiction to education.
Yes.
Thank you all for having me. I appreciate it. And just to poll the room really quickly, who has experienced stress before? Nobody?
Everybody's got to raise their hand.
I'm sure today, just experiencing stress, even today. So I think it's one of the bigger things that we always need to talk about. How do we de-stress? What does constant stress really lead to at the end of the day? What's that effect on our hearts? And what are realistically things that we can implement as we kind of go along through our days? So if we can go to our next slide, we'll talk a little bit about a couple of big things. Blood pressure and stress is a huge piece. That's a very, very big topic that I hope that all of you are taking your blood pressures, even if they're good, even if you think they're great. It's always a good marker for us to kind of be able to keep track of what's going on. It's an indicator of that time period, not something that's going to be a if you're good that day, you're good for forever. It's something that we want to always make sure to consistently measure and be able to keep track of. The other things that we're going to talk about are signs and symptoms of a heart attack, which I think is always really important to talk about, and then steps to improve your overall cardiovascular health. Next slide. So a little bit more about importance of monitoring your blood pressure. So next slide. The big thing that I'd like to really note, I know last year I came and spoke about women's health. I think a huge piece to really note again for women's health is that cardiovascular disease actually causes about 1 in 3 deaths in women. That's a really big percentage. Really, really big percentage. Just look at the number of women that are in the room. That is a lot of us in this room that cardiovascular disease affects. And there's a lot of women who are, especially in Cortland Manor, not pictured here, right? So thinking about that, that's 33% of women overall is way too many people. So definitely really key for us to be able to know a couple of different things like knowing your numbers, and we'll dive a little bit deeper into that. But obviously health risks really come from a good piece of it from genetics, and sometimes our genetics betrays us a little bit. And you know, we may be predisposed to some things that we want to really make sure we kind of keep track of. Like, for instance, if your immediate parent has a history of heart attacks, multiple heart attacks, we want to go ahead and make sure that you're going to be okay, right? A lot of those things do get passed down in terms of our genetics. So genetics is a huge piece that could be able to help your future generations really be able to understand a little bit more about what they need to do as a plan. You know, for instance, I had a patient who tested positive for high lipids in their blood. And so they had to kind of look and say, all right, we're genetically predisposed to really high cholesterol. And because of that, their family members were put on, you know, a watch, all right? Like, once your kids hit their 40s, like, what's their LDL? What's their HDL? How do we see like what their numbers are in anticipation of how to do more preventative measure, that public health piece? How do we do those public health preventative measures to make sure that we can actually ensure that you're not going to have that heart attack issue? So we can put you on medications, have you go exercise, eat healthier, have you be more mindful of those pieces and parts, because we can learn a little bit more from your DNA and be able to tell those pieces. So I think those are always really important pieces, is to look at your personal risk factors and your family history. In terms of a little bit more about facts about women, cardiovascular disease actually kills more women than cancer does. So that's a really big percentage, unfortunately. And just kind of based on baseline knowledge, according to the American Heart Association, only 44% of women even think that there's any association of being a woman and having cardiovascular disease. This is a very low knowledge, low knowledge about how your heart can really affect your overall life. So definitely making sure that we're really keeping track of our family members and really making sure like our coworkers get our consistent checks as well as our family members. I'll say for another kind of fun fact, I guess, from the American Heart Association is that females above the age of 20, actually 45% of them are living with some sort of cardiovascular disease, which is an insane number. So it's something that definitely make sure you're checking in on your loved ones. And a lot of those, because of your age frame above 20, about 10 to 20% is actually those who are pregnant get affected by cardiovascular disease. So a lot of things to kind of think about, especially as I know a lot of folks have kiddos and grandkiddos to kind of worry about, just to keep those things in mind as well. So when we talk about knowing your numbers, can anyone, without looking at the screen, tell me what a good blood pressure would be?
Well, it depends on the person.
120 over 80.
120 over 80, yes. So our goal is less than 120 over 80. Why we say that? We look at what the blood refilling of the heart is. That's kind of what your blood pressure is telling us, is how much is your blood actually filling the chambers of the heart. So if there's too much pressure, that's not great, right? It's a lot of pressure within the actual heart structure. If the heart is only this big, well, it's not stretching too much, right? This is muscle at the end of the day, but at the same time, it's not stretching too much. So it's not great for the heart to stretch too much. We definitely want to watch what the pressures are going to be like. It's kind of like if you're thinking about blowing up a balloon. At one point, the balloon can't really be blown up much more, right? There's going to be a time where your heart's obviously not going to implode like a balloon, but there's a pressure point where it's not going to be okay anymore. So we definitely want to make sure the blood pressure-wise that we're being very mindful. Thanks for letting me borrow yours. So making sure, once you hit consistently above what we normally would say like 140, 130, I'm still like okay with for the most part. But if we're consistently hitting above that 140 for that top number, I'd really suggest for you to go ahead and touch base with your primary doctor or your cardiologist. We would want to lower some of those pressures because, again, the heart itself physically can only have so much pressure. It does lead to a lot of other problems, so we want to make sure that that blood pressure is under control. And a lot of the time that does require, sometimes some medication, but sometimes, honestly, we really encourage walking. Like, I know it seems like such an easy fix, but walking really kind of does help lower your blood pressure, helps lower your blood sugar. It helps, lower your cardiovascular risk. So we really, really highlight for you to implement a walk. I know it sounds maybe a little too simple, but that's kind of a nice, good first step. The best time for a nice 10 to 15 minute walk is right after you eat. That's actually been proven to be clinically the best time to take a walk, mostly because you're actually going to use the sugar that your body just ate, and you're actually going to be able to use that sugar and instead of having it store as fat. So it's the perfect time to take a walk. Make sure you kind of implement 10 to 15 minutes after each meal. That's actually been proven clinically to be very, very beneficial. When we talk about the good cholesterol and the bad cholesterol, I feel like sometimes people talk about it and people glaze over. They're like, what does this mean? What is the good cholesterol and what does the bad cholesterol even mean? The easiest way I like to think about it is everyone has seen a milkshake in their lives, hopefully, maybe. So if you think about it in that way, everyone's probably had a milkshake in a straw and knows that it is a struggle sometimes with the milkshake in the straw. And sometimes when you're sucking up the milkshake, everything gets too cold on the outside and it gets totally clogged in that milkshake straw, right? Kind of the same deal with your LDL. That's the bad parts of this milkshake straw. So you're trying to suck it up, the blood's trying to go through that straw, which is like your veins and your arteries, and basically that bad cholesterol gets stuck on the side of your veins and your arteries. Same kind of deal with the milkshake, right? Like everything gets a little bit clogged. The actual space that you can have flow gets limited because of the amount of space that's available. So at the end of the day, we always want blood flow to the heart. That's kind of what the veins and arteries purpose is really making sure that you get blood flow. Everything needs oxygen at the end of the day. Breathing is good, right? So for that piece of why we need that open artery and open veins is so that your actual muscles can get oxygen and they can do a good oxygen exchange, making sure that your heart beats, your brain gets nice blood flow, all your limbs get beautiful blood flow as well. So when we have that blockage, that's when we have that problem, and that's when people start feeling like they have that thing called a heart attack. That's kind of basically what a heart attack is that you limit blood flow to the actual physical heart, and that's not good. So we want to open up those pieces and make sure that there's ample blood flow, open up that milkshake straw and make sure that there's ample flow and that we don't have any blockage. Any questions for that? I know it's like a weird way to describe things, especially with cardiology, to talk about a milkshake. But
Can I just ask
Yeah.
one? You were saying if your blood pressure, if it's a little higher, when that's, I mean, I thought if you sat down and relaxed and didn't get up, and it was the best thing to do. But you're saying maybe if you find a little, you should get up and walk a little bit.
So I would
Did
say
I misunderstand?
if you're consistently taking your blood pressure, noticing that it's a little bit on the higher end, include some more walks. If you're, let's say, taking your actual blood pressure right in that moment, making sure that your feet and your arms aren't crossed. If you cross them, they actually increase your blood pressure. So if you make sure you uncross them, sit down for about 5 minutes, relax, take your blood pressure, that'll be the most optimal time to take it, is like when you're calm, take it, like
Okay.
have a second
Thank you.
to yourself. Does that make sense? Otherwise, to lower it overall is to include that exercise piece. That's like when it's most helpful, is to like long term, like take it down a little bit. That's when exercise is like the most utilized
Thank you.
for that. Blood sugar wise, we always want to kind of keep a heart healthy diet, of course. 5.7 is kind of the good cutoff zone. Anywhere below 5.7 is good. And then otherwise 5.7 to 6.4 is more of like our pre-diabetic zone. So it's just making sure that your blood sugar is watched out for. So when we talk about that, blood sugar under 5.7 is a 3-month marker of how you're eating overall. So it's not like today I ate too much sugar for breakfast or whatever. It's actually looking at 3 months' time of what your eating habits are like. So making sure that you're under that 5.7 is really key. Even if you're a diabetic, it just means that you're taking your insulins correctly and making sure that you're taking enough insulin to make sure that you're in that zone of a good zone. Does that make sense for everyone? Okay.
Is that number the A1C?
Yes, the number is the A1C.
The
Yeah, the
A1C.
A1C is the 3-month marker. Otherwise, sometimes your doctors might take like a one-time blood sugar. That's not really super indicative of any like real clinical knowledge for us. It might just tell us in that day you might have had some candy or whatever's going on. But the A1C tells us a 3-month marker of like over time, how is your body processing sugar and how is your insulin reacting. And then, of course, we're always looking at healthy habits. Try and increase. I know I tell my parents to try and walk, and they look at me like I'm asking them to do a very daunting marathon. We're not asking much. We're saying 10 minutes after every meal, 30 minutes per day. You know, if you can hit 10,000 steps, great, fantastic. You know, really, it's the point of really just trying to include exercise throughout the day, because it is really easy to not do that. Especially, you know, I know especially for my parents, like they live in Ohio, it is very easy to not have to walk because they can drive everywhere they need to go. They don't really need to walk everywhere. So, you know, just try and include a little bit more exercise in the day. I think that's always really important. And then next slide. So the bigger things that we always really want to focus on is, of course, smoking and drinking obviously always causes a little bit more stress for your blood pressure going up. So making sure that you do take appropriate measures to decrease smoking, stop smoking, or at least increase the amount of exercise. The big thing is to really stop smoking and no drinking of excessive amounts of alcohol, overeating, and really trying to change your lifestyle overall. Those are the biggest things that can really impact your day-to-day. I know for some folks, for exercise-wise, maybe you're not like the most physically stable in like a walking sense. There's a lot of little things that you can do instead of like physically walking if you're not like, if your gait is not the most physically able to like steadily walk across the room, and if you usually need like a walker or something like that, there are like devices that you can use that are almost like stationary bikes that go directly under a desk, or sometimes I say directly in front of a TV, that you can just use and just pedal, and that's really helpful if you're not able to like necessarily go outside because it's freezing outside, or any of those types of things. So you can always figure out a new plan, or do weights whilst you're watching TV, or, you know, there's different ways to implement exercise that it doesn't have to be a daunting task, and make it feel really scary and like a giant time commitment. Next slide. Other things, of course, I think we always say try yoga and meditation, but in real life, who has the time? But I think, you know, try and do something for yourself. One of the best things I've ever learned from one of our heart transplant social workers is you have to be able to fill your own cup before you fill others' cups. So you have to do something for yourself, even if it's for 5 minutes, yoga or meditation, or if it's reorganizing your schedule for yourself, or practicing deep breathing, or sleeping an extra 5 minutes, or getting moving that gets you going, or adjusting your perspective of how you approach a problem. Those are all different tactics, but at the end of the day, you need to take care of yourself before you can take care of the lovely folks in Cortland, or just taking care of your family or taking care of your friends. So making sure you refill your cup is definitely a huge piece. And then next slide, just some mental health resources. And then next slide, we'll talk really quickly, I know I'm a little bit over on time, on signs and symptoms of a heart attack. We can go to the next slide. So kind of the idea of the milkshake straw that we had talked about, this is the straw, and the yellow stuff is the milkshake. That's your bad cholesterol, the LDL. So that bad cholesterol buildup can be there, and that's what we kind of talked about earlier in terms of a heart attack. So it's really just opening up the blood flow and making sure that the actual heart gets oxygen at the end of the day. I know I explained it very quickly, but any questions? Okay.
Does anyone have a question?
No.
Okay, thank you.
Warning signs, if you can go to the next slide. Chest discomfort, discomfort in the upper bodies. So most folks feel it in the arms, shortness of breath. Some people feel nauseous. Some people feel a rapid heartbeat, or tiredness, cold sweat. So those are definitely some different things, except for women do present a little bit differently. Some people feel a little bit more nauseous, a little bit more epigastric pain, meaning some tummy pain. They feel more upset stomach, more shortness of breath sometimes. Women tend to write off those feelings to something else typically. So just making sure like you're being very mindful as you know your body best. And if something feels wrong, just make sure you go to the ED and get checked out, and making sure that at the end of the day, you're taking care of yourself and being your best advocate. Next slide. So we'll talk really quickly about making lifestyle changes. I know, again, we've already talked a little bit about them. If we can go 2 slides forward. Thank you. Good nutrition, of course, whole grains, variety of fruits, veggies, poultry, fish. Everything is about a balance. We're not saying don't ever eat your favorite food ever again, because let's be honest, favorite foods tend to be a bit junkier foods. We're just saying moderation, everything in moderation. Just don't go overboard. Being physically active, finding a good support system, knowing your numbers, like we talked about, heart rate, cholesterol, blood pressure, sugar levels, making sure that, no smoking or exposure to secondhand smoke if you can avoid it, and making sure that you're eating foods that are low saturated fat, trans fat, sodium, added sugars, that type of thing. Sorry, I tried to talk really fast because I knew I went over time.
No, you're fine.
Any questions?
Very good.
Happy to stay late too.
If there were 3 things that you could tell, this was great. If there were 3 things you could tell people to take away with them from today that would be most important things you could, what would they be?
Exercise. I think that was something that I didn't really appreciate when I was younger, was the ability to move your body. And I think the integration of exercise in your health, I feel like people always talked about it, but I didn't really put 2 and 2 together until later in life, where I was like, oh, this kind of affects everything. Like exercise really affects everything. Your food choices really integrate into everything. Like it's not just that one choice of like eating something because you just need something quick, but like all of those choices really add together and combine into your health. And like as time goes on, I think that has definitely been something that, you know, I'm seeing my friends like see how their food really affects their well-being, how their exercise really affects their well-being, like their overall total health. Like I think it's an underrated piece. I think people focus on being skinny, but not necessarily focus on being healthy. And I think that's a really big piece that we don't have a good conversation about. I think definitely the nutrition aspect, of course, is a really big piece. And knowing your genetics, knowing, you know, the family that you come from, like what did happen with grandma and grandpa, like what family history do they have that can affect you or affect if you have kiddos or affect cousins, like what's kind of that big overall piece that we see ourselves kind of affecting everybody.
And Christina, the cardiac catheterization lab.
Yes.
The
Is
exercise is about to have its 3rd anniversary
Yes.
on April 25th.
yes.
What is the advantage of having that in the next, Yorktown, Cortland's the next town. What's the advantage of having it right in the next town?
So when we talked about that heart attack piece, that blood flow piece, blood flow is time. Time is tissue at the end of the day. For us to be able to give you that opportunity to have something closer to home and more local, that is your tissue we're talking about. That's your blood flow. That's blood flow to your brain. That is blood flow to your organs. That is the biggest piece for survival, right? That is kind of the whole point of interventional cardiology. I know it's like when people talk about cardiology and then you break it out to like all these different pieces of it, it's like so confusing. But interventional cardiology really focuses on blood flow. And that's the piece when we're talking about when people say, oh, my dad had a heart attack or, you know, this, that, like, God forbid. But, you know, those are the pieces that we're looking for is time. You know, we're trying to avoid open heart surgery, avoid that cardiac surgeon. The interventional person is like the less invasive way for us to be able to go ahead and open up that artery, to be able to actually give blood flow to the actual heart and be able to give oxygen to the heart, brain, all the organs. That's kind of the big piece.
When you say exercise,
Yes.
if you're very active in your home, walking around, going shopping, does that count? Or does it have to be a formal exercise routine?
I will take anything at this point in time from people. No, I mean, look, at the end of the day, if it's getting your heart rate up, right, that's kind of the goal of exercise is to get your heart rate up, to get you moving, to get the blood flowing, to give your tissue more flow at the end of the day. So honestly, I take all forms of exercise. So if you want to go to the grocery store and that gets you moving, that's great.
Well, I mean, even in your home, if you're active, you're walking up and down stairs, does that count? Or does it have
I
to
will
be a
count
formal-
all of it.
Yeah.
I will count all of it. I'll take all of it, whatever exercise you're physically able to do. Because I think, you know, we keep in mind, like, not everyone's able to go run a mile. Not everyone's able to go do 10,000 steps. I think it's what you're comfortable with, and try and push yourself a little bit, of course. But I think, you know, we always try and keep in mind what everyone's physically able to do. Age frame is different. Like, you know, your 19-year-old kid is probably going to be able to run way more than I'm going to be able to run. And perhaps, you know, do it within your range. But I ask to push yourself
Stay
a little
active.
bit. Try and incorporate a bit more. You know, postprandial, that time frame right after you eat is really big deal, because it, again, does really lower your blood sugar, and that eventually helps with your hemoglobin A1C.
In other words, don't sit and be a couch potato for 3 hours watching TV.
Yeah, pretty much. You know, I'm not gonna lie, because let's be honest, everyone wants to kind of just like relax after you eat dinner, and to encourage people to walk 10, 15 minutes is a tough feat. So, you know, we're just saying, if you want to be a couch potato, maybe add the stationary bike piece.
There you go.
Or like, you know, some baby weights. You can incorporate it in different ways.
Add a dog.
Yeah, add a dog to your life. Then you'll really get walking.
Anybody else? I found it very, very interesting. I've learned a lot.
Oh,
Thank
good.
you.
Thank you
And,
very
uh,
much. Thank you.
I just want to remind everybody, I'm sure you all know that the New York Presbyterian Hudson Valley Hospital has been our sponsor, and they've always supplied us a great lunch, and I hope everybody's enjoyed their lunch. And now, are you going to introduce the next speaker?
No, Rachel is.
Oh, okay.
I'll
sorry.
introduce Rachel Amorosa.
Okay.
My laptop is very large. Hey everyone, I'm Rachel Amorosa. I'm the Executive Director of Marketing and Communications for Pro Clinic Sports Physical Therapy and Chiropractic. I do want to thank everybody for allowing us here today to speak a little bit about our practice, what we do, and how we can help support our community members. I'm actually, I live in Yorktown, so we've been open now for about 10 months in this location, but we have 7 throughout Westchester total. And it's been an absolute pleasure helping to serve everybody in this community, and it's really been absolutely amazing. So to also kind of segue off of that amazing presentation,
Right.
we kind of can fill some of those questions about exercise and just remaining healthy and what that actually means and how we can help. So I have the absolute pleasure of introducing Dr. Alan Siegel. He's managing partner of Pro Clinics, and I'll have him kind of take it away from here.
Good afternoon, everyone. Thank you so much for having us. Like Rachel said, we've been in the community since July of 2024. It's been an absolute pleasure to be part of this community. We're getting to know, a lot of people at the board level and at the community level, and we're very, very excited to be here. So thank you very much for that. Like the doctor was saying before, movement, exercise. We're in the physical therapy space. We provide sports physical therapy, acupuncture, chiropractic, massage therapy, and a few other services. It's very important that we take care of our physical body as much as we take care of our mental state as well. So, quick question: does anyone know how many human bones are in our bodies? Greater or lesser than 150? I want to get
Greater.
Greater. Okay, good. Right. Yes. So there are almost 260 bones in our body at times, and something can always go wrong with a bone, as we know, right? God forbid we have a fracture or a trauma or a fall or a spill. I'm sure you've had friends or family that have had injuries from some kind of fall. With the senior population, as we get older, sometimes balance becomes an issue, coordination becomes an issue, different types of problems can occur, from a physical perspective. So, as a physical therapy office and a movement office, we take care of, all bones, all muscles, all joint, all tissue as best as we can from a physical perspective, trying to help everyone continue to move. And exercise is key, like the doctor was mentioning so much. I always said movement is life. The more we move, the more we're living, right? The less we move, the less we're living. So we want to keep our bodies moving in a forward, backward, upward motion, whatever you want to do. But movement is key. Keeping our bodies healthy, eliminating things that can be detrimental. Excessive alcohol, smoking, excessive sugar, not great for the joints. Over time, we all have genetic dispositions as well, but that's something that we need to talk about. I'm sure everyone in the room has had a friend or a family member that's had a hip replacement or a knee replacement or some kind of spinal surgery. We help with the recovery and all of those conditions. So I'm just going to ask to go to the next slide. I just want to go through some of the stuff. As part of being part of the community, one of the things that we try and do is we like to bring people into our facility, show them the equipment that we have, show them what we could do to help their bodies keep active, keep healthy. If they have any particular conditions, we take care of so much. So just to make this announcement, I'll finish with this as well. Thursday, May 1st, between 11 and 12, we're going to have a senior meet and greet with our Yorktown team, so you'll have an opportunity to come in meet with our physical therapists, meet with our massage therapists, meet with our acupuncturist, learn more about what we can do for the community, what we can do for you if you're having any particular, conditions or problems that you want addressed. We know, spine and low back and hip and, neck and shoulders, those are those most common things that occur at any age, quite frankly, sports injuries, et cetera. But, it's nice to come in, meet your therapist, meet your team, meet your local community members that can help with whatever may be ailing you. So we'll serve lunch that day. If you don't know where we are, we're 354 Downing Drive. We're next to the Coach Diner right there. We share the parking lot right there, across the street from that Citibank shopping center. So, and we're in the corner there. So we hope anyone that wants to come, they can either scan that off of the TV, and there's an RSVP for that event. But we want to welcome people into the facility. We've built a very nice, beautiful facility for the community, and we want everyone to be able to come in and enjoy it and see that. So, all right, so next slide if we could. Thank you. All right, so just know a little bit more about what we do. So physical therapy, I know most people have probably had or experienced physical therapy in their lifetime. If they haven't, you probably will at some point, unfortunately. It can be for anything. It could be pre-surgical, post-surgical. A lot of times people think they have to be in pain to actually have a physical ailment, and that's not necessarily true. I'm a perfect example of that because I'm not in pain, but my shoulder does not move as it should. So if you have physical limitations, you can't reach up into a cupboard and you feel like something's getting stuck, or you can't bend over and touch your shoes without like a little bit of a pull or a strain or something. There's a lot of different indicators for functional improvement. That doesn't always mean pain is the only indicator for needing physical therapy. A lot of people say, I need to be in pain. Well, you don't need to be in pain to actually have a functional deficit. So you want to just be aware of your body, say like something that you maybe used to be able to do, now you can't do. And then eventually, if you don't treat the problem, the root cause of the problem, the pain may follow. So a lot of times, most people wait till they have pain, till they realize they have a problem, but sometimes it's nice to know ahead of time before the pain. Just like trying to prevent a heart attack, you want to try and prevent a rotator cuff, strain or tear, because the shoulder already has like maybe a little bit of arthritis in there, and then you don't try and correct those problems. So rehab is good. Neck, shoulders, hips, low back. We go head to toe pretty much. So whatever the ailment is, for physical therapy, you don't need a prescription anymore. This is something I like to bring up for New York State. Physical therapists have what they call direct access. So if you have a particular musculoskeletal complaint or a problem, you can come in, work with your physical therapist, get things going right away.
Is it covered by insurance if you don't have a doctor?
Yes, it is. That's what people don't know. So even with Medicare, you can come in. The requirement is that you have 10 visits or 30 days. And then what we do is we'll work with even New York Presbyterian. We have a great relationship with the orthopedics over there. We'll refer you out to a specialist based on what your condition is or what your concerns are. So always if we feel there's something that needs immediate assessment, X-ray, MRI, or whatever, we can get you out to that proper evaluation with the proper specialist. But physical therapists are very well versed in musculoskeletal conditions. They can evaluate you, they can treat you, they can probably get you feeling better pretty quickly, and then you can go forward from there. So even if it's Medicare, you do not need a prescription to start with us. So if you have, a lot of times people already know what's wrong with them, or they've already seen their doctor, and
Right.
Whether they've gotten the prescription or not. But I do like to, because this way it kind of it gets you started a little bit quicker. So, and we have like the bikes and the UBEs and the treadmills, so things that we can get your body moving. So. Chiropractic also, we have also no prescriptions necessary for the chiropractic care. You have a question?
How do you not, if you don't need a prescription, how are you going to get paid, and how would I get or if I pay, how to get reimbursed from Medicare?
Good question. So the question was, without a prescription for physical therapy, will we get reimbursed from the insurance company? And the answer is yes. So again, the New York State law is 10 visits or 30 days, whichever comes first. After that, we do need the prescription. So if we need to refer out, or you have a general practitioner, a family medicine doctor, orthopedic pain management, they can write out the prescription. We also have nurse practitioners on staff that can also see you as well if you needed to get further evaluation. So that's the same with Medicare as well. You can have direct access with Medicare, so I like to make that clear. So a lot of times people don't want to go to 10 different doctors just to get started, so that's good. So chiropractic, same thing, no prescription. We have a special piece of equipment in our office. It's very good for like low back patients. It's called flexion distraction. It's a very mild, gentle. I know chiropractic gets sort of like a, kind of like a very, crack and hit, and people get a little nervous with that. So we have a very specialized machine that's a very low velocity, very gentle, mild, low back treatment, and actually into the thoracic, which is your mid back, and even into the cervical a little bit. So very non-invasive, very hands-on, very gentle, distraction of your joints. When you may have a disc problem, people have heard of like herniated discs and stenosis in the spine, facet problems, arthritis in the spine. This can help to open and close the joints a little bit, create a little bit more space, take pressure off the nerve roots. So it's a very nice, gentle thing for the low back. We do massage here in Yorktown. We do have a pelvic floor therapist. She's really, truly down at Ardsley at the moment, which is a little bit far from here. But and then acupuncture. Also, our practice is unique because we can take Medicare acupuncture patients where a lot of practices can't. So that also does not need a prescription. It just is done under the guidance of our nurse practitioner, who is also a licensed acupuncturist. So so if anyone's looking for treatment for low back pain, and acupuncture has a whole host of other things that you can treat, but low back pain is one of the things for Medicare, but she'll treat people with things, anxiety or even blood pressure, stress, insomnia, digestive problems. Yeah, question?
When we talk about Medicare, is it just straight Medicare and Medicare Advantage, or one or the other, or both?
Good question. Mostly it's the federal plan, federal plan. Some of the Advantage plans definitely cover physical therapy, definitely cover chiropractic. Sometimes we have to call on the acupuncture, but I think they do cover some of the Advantage plans as well.
If someone went in, you would check that first.
Yeah, we verify all the benefits, and we let you know what your coverage is. So at least you know what the coverage is for that service. So that's a good question. Okay, so next slide, please. All right, so just some common, conditions that affect older adults. I think we went through this, but we deal with most of these things. Osteoarthritis, which is your run-of-the-mill, general arthritis in the back. Rheumatoid arthritis is more autoimmune, but it still affects the joints from an arthritic condition. Some other spinal issues we spoke about, tendinitis, bursitis. Anyone that has joint replacement surgeries, spinal surgeries, neurological conditions, which Parkinson's, MS, neuropathies, balance and gait disorders, we will manage those in the office as well. So we, not just surgery, not just bones, we handle some other neurological conditions as well. So pain management, neck and back pain are your most common. Fibromyalgia, headaches, migraines, those can be related to like cervical issues. Mobility and function, general deconditioning, fall risk issues, and postural dysfunction. So posture, is important. Movement is important, and these are the things that we address. Okay, so next slide, please. Any questions? I think we went through some of this, the direct access, the Medicare stuff we spoke about, the insurances. We pretty much take most insurances, so there's not really any plans. Aetna, Cigna, Blue Cross, Nice Ship, Empire Plan, Swiss Chip, Medicare, no-fault workers' comp. If you had cases that were related to an auto accident or a workers' comp-related injury, we also can work with those insurances. Those are, unfortunate accidents. So, let's see, next slide. Is that the last slide? One more. That's it, I guess. Okay, good. So any particular questions about the practice or anything that we do that we can help you with?
Yeah, in the back. He's got cards in the back.
Okay.
Just to restate for my senior brain, if I'm concerned about my balance, I can come into your office without going to a doctor, getting a prescription, and you will look to see if I'm covered for 30 days, 10 sessions?
Correct. 10 visits or 30 days.
10 visits or 30 days.
So
That's it. You could just come in and start. We could start a balance therapy program with you right in the office. Now if just to be clear, if the therapist feels that there's some other medical issue or something that needs to be addressed that has been addressed elsewhere,
Okay, then
they
you-
will definitely work with you and or your GP, your cardiologist, your orthopedic, whomever. We always want to coordinate care for the safety of our patients and make sure that God forbid there was something underlying that wasn't addressed earlier, we would want to, but you can get started. But if they said, I can make a very, example, like someone thought they came in, they went for balance, but they might have just had like a TIA or a stroke, surely we're going to send them.
Okay.
So we just have to be careful of the assessment and make sure. But most people that are walking into our office, they're like, oh, I woke up funny, my back hurts. Okay, we can handle that. We know if there's a history of present illness or chief complaint, and you go through your history, we know why this particular thing started. We address it and we assess it and we treat it. And
So in other words, we don't have to call for an appointment. We could walk in, or do we call?
well, okay, for the appointment you should call, but just call, say, hey, I'd like to come in to address my back, my shoulder, my knee, my hip, and you just come in and we'd set the appointment, we get you started,
Very good.
and you can, and then if we could send a report to your doctor, whether a GP, an orthopedic if you have one, and again, a lot of people know what they've already had or they don't know, but either way, we can help and address that. So I think it's a good thing for seniors to know that you guys can get moving as quick as you want to be.
Definitely.
So, yeah. So.
Any questions from our people out there?
No, yeah.
The acupuncture.
Yeah.
Does that cover all of it, or it just focuses on one of the things one at a time?
The acupuncture can cover, so, it depends on the insurance, quite frankly. Some only want to cover for quote-unquote pain. Some will cover for low back pain. Some are a little bit more broad in terms of like what types of diagnoses you could do. Unfortunately, insurance companies are very controlling of things, and they only want to kind of pigeonhole like
They don't want to pay out.
Yeah, they don't want to pay out for certain, but that's okay. That's a whole nother story. But we do our best to get the coverage for our patients. So that's our job, is to let you know what the coverage is, and we work it out for you so you can get care. Our goal is to give you guys the best care we can give you. So we deal with the insurance as best as we can to get that covered for you. So. Most sessions are about 45 to an hour. Yeah. So she'll leave you in the room with the acupuncture. Sometimes depending on what the condition is, she'll treat you, face up and then face down, depending on what's going on with that particular patient. So.
All right. Well, if there aren't any other questions, I want to thank you very much.
Thank you. Oh.
Well, again, if it's insurance based, we bill the insurance and then we get reimbursed from the third party payers. If it's self pay, we have reasonable rates. Most visits are under $100 in the practice. So it just depends. It depends on what you're doing. If it's acupuncture versus massage versus PT, but most of our services are but most people have some kind of insurance coverage that we can work with. So we try and keep it to a copay for the insurance company. So again, I just want to thank everyone for having us and the community. We're very excited to be here in Yorktown. It's been a great year so far, and anyone that would like to come to that event,
May
1st, 11 to 12. We're happy to have you guys come. I think once you see the facility, you'll find it as a very open. We have big windows, very open space, very nice place to kind of get your body moving. And like the good doctor said, exercise and movement is key. And I always like to say movement is life. So I'll leave it on that end of note. So thank you very much. Okay.
Thank you.
Carol, do you have anything else you'd like to say?
No, I have nothing.
Just a reminder that if you're going to get on a flight, a domestic flight, May 8th, the deadline for your real ID is May 7th. Otherwise, you're going to need your passport to board a domestic flight. So just a reminder.
Okay, and also it's on the agenda where I want to remind everybody of the ARP driving safety courses, and they're May 4th and June 8th at the hotel in Mount Kisco, and check it out. It's supposed to be very good for you. You get a discount on your insurance. And we just like each month we remind you about that. I'm so happy we had a nice attendance. You enjoyed your lunch. And our next meeting will be on May 16th, Friday, May 16th. So we look forward to seeing you. And if anybody has any questions or anything that they'd like to ask, otherwise the meeting is adjourned.
Thank you.
Thank you.